Good afternoon. My name is Ken Haller. I'm a pediatrician in St. Louis at St. Louis University School of Medicine and Cardinal Glennon Children's Hospital. Today, we're going to talk about vaccine hesitancy, moving the needle for vaccine hesitant parents, as well as talking a bit about COVID vaccine acceptance. The goals of the session are to help to gauge the emotional setting where parents are making decisions about vaccinations. We know that this is really key to getting people on board to get their kids vaccinated. We have to find common ground with parents so we can establish a trust relationship to let them know that we want the same thing as they want, which is for their kids to be safe and healthy. We also want to create and utilize effective scripting to present factual information that will help parents make healthy decisions about vaccination. I have no relevant financial relationships with any manufacturer or of any commercial product and or provider of commercial services discussed within the CME activity, and I do not intend to discuss any unapproved or investigative use of a commercial product or device in this presentation.
When a vaccine hesitant parent comes into our office, what do we really want to say? Well, if I were Mr. Spock, I would say this. But what we often want to say is something like, "Are you kidding me? Are you saying I want to poison your child? Do you think I'm an idiot? Why are you being an idiot? Jenny McCarthy is full of crap. If you really loved your child, you'd get them vaccinated. And I care about your child. Why don't you?" Now, those are the things we want to say. And unfortunately, I have actually sometimes heard pediatricians say those things, but I think we all know they're not effective. To think those things, to feel those things, that's okay. But I think of those as little thought balloons that are up by your head, like in a cartoon, and we can push them away because they're not really helpful. But why do we feel these things and why do we want to say things? I think it has a lot to do with the culture of our professions. Within our professions, we tend to be hierarchical. Even amongst our professions, we tend to be hierarchical, but we are given so much power by society that we can unconsciously take on a hierarchy with our patients and with our clients, so that we think that whatever we say is automatically going to be believed. And that's not necessarily the case. We also have faith in reproducible evidence. That's the basis for everything we do. Studies, collecting data, large, powerful sets of data give us evidence for what we do. But that's not how people work on a day-to-day basis. You don't have to spend more than about 20 seconds on social media to know that. Also, we're geared toward problem solving. When people come in and say, "I don't want to get my kid vaccinated because I've heard that it can cause autism," that sounds like a problem that needs to be solved. And our solution to it is, no, that's wrong. There's plenty of data to show otherwise. What a person is really saying is, "I'm scared about something I've read and I need your reassurance." So we have to use a different means of communication at that point. Also, frankly, the way we get information often comes across as an interrogation. We often ask a series of questions because that's what our electronic health record requires of us. And people can get the message that the only information that's important is the information that we are seeking through these questions. And they may have important information they want to give us beyond that, but they don't know where to put it in. So we have to go from interrogations to conversations. Finally, I know for myself, and I think for most of us, a lot of our positive self-image comes from our profession. It comes both externally from people saying that we are doing a wonderful job, and internally because of all the things that we do to make the world a better place. Now, this slide, this is the 2021 vaccination schedule. There's a lot of stuff on it. Now, for me, that's great. It tells me that there are all kinds of vaccines that we can give kids, all kinds of ways that we can prevent disease. But for the layperson seeing this looks like a lot of stuff that we want to put in their kids' bodies. And that can be kind of daunting. So then we get to the question, that people ask all the time: why do you give these vaccines to kids? And this is where I want to talk a little bit today, just in general in this talk, is what is good scripting for this? What, from a health literacy standpoint, is a good way to communicate these messages? Well, I say that we want to give them because these microorganisms, whether they're viruses or bacteria, are, or they have been, common in the population. They cause terrible disease in kids, particularly in young kids, and researchers have developed vaccines for them so we can protect them. So, for example, pneumococcus, bad disease, common in kids, we got a vaccine. Rotavirus, same thing. Anthrax, really bad disease. It's not common in kids. We have a vaccine for it, but in 40 years, I've never given an anthrax vaccine to a kid. On the other hand, RSV is very common. It's a bad disease, but we don't have a vaccine, and I would love to have one for it. So why do we use this schedule and this spacing? Why are so many things given early? Well, it's based on how vaccines were tested, how they were approved, and it fits the need to get kids immunized early and as safely as possible. So example, pneumococcus, Haemophilus, they can cause meningitis, they can cause sepsis, they can kill kids when they're very young. So we want to get them vaccinated very early. And this schedule represents a consensus from representatives of the Advisory Committee on Immunization Practices, which is in the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians. And then state and local jurisdictions are what decide which vaccines are given and when through regulations, generally on entry into daycare and into school settings. So when people ask me, well, how do these vaccines actually work? The basic explanation I give them is that a vaccine, for at least for these injectable vaccines we give to young kids, includes small parts of the microorganism, of the virus or the bacteria. So if this is the virus, which would be scary if it were that big, people smarter than me have taken a protein from here and a protein from here and maybe a polysaccharide from here, little parts of it that are just enough and just enough different from human proteins and polysaccharides that when they get into my body, my immune system's wandering around going, oh, that's Ken. Wait a minute, that's not Ken. We got to do something about that. That's when white blood cells, for example, will take these things to places like the bone marrow, to lymph nodes, and start creating immunity. It basically puts up a wanted poster in our immune system so that when these things roll around again, the white blood cells that are dedicated to getting these guys will know to attack them right away rather than waiting a week until they can cause all kinds of problems. So with all this science behind us, why do parents refuse vaccines? Well, I'm sure that you have all heard things and all have stories to tell. But vaccine hesitancy is really complex. The World Health Organization defines it as a delay in acceptance or refusal of vaccines despite availability of vaccination services. Vaccine hesitancy is complex and content-specific, varying across time, place, and vaccines. It includes factors such as complacency, convenience, and confidence. I love that because I love alliteration. But this tells us a lot. Confidence is what we usually talk about, the sort of stereotypic anti-vaxxer. It's just like, these things are going to hurt my kid. But there are two other things here that are really important. One is complacency. Frankly, a lot of the things we vaccinate against are not that common anymore. Things like pertussis, polio, even measles. We have outbreaks, but they're not as common as they used to be. And since they're so uncommon, people may think, what's the point? Vaccines in this way are a victim of their own success. It's also a matter of convenience. One of the issues around the current COVID vaccine is that at this point, for the most part, you have to get them at special vaccine distribution sites. You can't, until recently, you haven't been able to go to your local pharmacy or your doctor's office to get them. And that's where most people get vaccines. So it's a really complex thing. We have to make sure that vaccines are available and that they're easy to get and that people have a reason to get them. So a little background on what it means to have problems with vaccine hesitancy. We hear a lot about it these days, but when you come right down to it, especially with vaccines for kids, only about 2 to 3 parents would fit in that hardcore anti-vax category that we talk about. About 20% of people have refused or delayed one vaccine, but those are the ones most of those people are movable. And one of the things that's really important to keep in mind, and there have been studies that show this, is that when it comes to this 20% or so of parents who have some doubts about vaccine, a strong recommendation from a trusted healthcare provider is enough just by making that recommendation to overcome about half of that. So that's why when people come into my office, I don't say, do you want to do vaccines today? I'll say, our plan today is to do this and this and this and these vaccines. What questions do you have for me? For those people who are a little vaccine hesitant, about half the time, that will take care of about half their hesitancy. Now, where does vaccine hesitancy come from? Well, there's this guy that we have all heard of, Andrew Wakefield. He wrote that notorious paper in The Lancet in 1998 that purported to show a link between MMR vaccine, the measles, mumps, rubella combined vaccine, and autism. Now, the paper, as we know, is a complete crap and a complete fabrication. And I don't want to go into it much more than that. But the thing is, he didn't start it. If anything, he just helped to springboard it to a new level. The thing is that vaccine hesitancy has been going on for a long time, since vaccines have been around. Seth Mnookin, in his book, The Panic Virus, which is about the anti-vaccine movement, talks about how remarkable it is that the makeup, rhetoric, and tactics of vaccine opponents have remained over the past 150 years. Then, as now, anti-vaccination forces fed on society about the individual's fate in industrialized society. They appeal to knee-jerk populism by conjuring up an imaginary elite with an insatiable hunger for control. They preach the superiority of subjective beliefs over objective proofs of knowledge acquired by personal experience rather than through scientific rigor. Now, frankly, this is not just the anti-vax movement. This is something that we have been seeing a lot in our social media. So to review quickly, vaccination goes back to Edward Jenner and him noticing that milkmaids in communities that were having smallpox outbreaks did not get sick because they had come down with cowpox earlier, and he posited that there was some connection between them. Now, interestingly, the word vaccine comes from the Latin vaccinus, which means of or from cows. So next time you're at a trivia night, that might come in handy. The thing is, though, that before vaccination, a cruder form of trying to confer immunity was called inoculation. So if there was a smallpox outbreak, people would go around to around the community, and if people had smallpox, they would get scabs from them, they get mucus from them, or pus, and they would put that into the abraded skin of unaffected individuals. And most people who got inoculated that way got a milder form of the disease, and most of them did well. But some people died, and some ministers would say, well, this can lead to death, so thou shalt not kill. And there were even anti-vaccine political cartoons like this one from 1802 called The Cowpox or The Wonderful Effects of the New Inoculation. This may be a little hard to see, but if you go from left to right, you see that people are taking this concoction, this thing on the left. And to go from left to right, we have people having little cows growing out of their ears and their cheek and their nose, and a woman who has horns growing out of her head. So people have always felt a little skeezy about the idea of putting something into your body or into your child's body that in another form might have caused disease. Beyond vaccines, there are a lot of other reasons why people might distrust a government program. In particular, the Black community is well aware of the Tuskegee syphilis experiments. This was a notorious experiment done by the U.S. Public Health Service, started in 1932, and they went to Tuskegee, Alabama, and enrolled a number of African-American men in a longitudinal study to see the effects of syphilis over time. Now, in 1932, there was no effective treatment for syphilis, but by the 1940s, penicillin had been discovered. Unfortunately and notoriously, these men were not told that penicillin would either cure their syphilis or at least arrest the further development of their disease. And many of these men died a horrible death. And this went on until 1972. And so when it comes to vaccines in the Black community, one mother says, Tuskegee always sticks in my mind, that you don't really know what's happening. And here these people were guinea pigs, and I just don't want my children to be any part of that. So with science on our side, why doesn't everyone believe us? Well, people can be spectacularly poor at risk assessment. The anti-vaccine movement has been really good at creating martyrs for their cause. Anti-vaccine advocates like ourselves, anti-vaccine advocates who oppose what we do, are pretty good at really compassionate messages with personal narratives, and pro-vaccine physicians and other healthcare providers, frankly, we can be pretty bad at it. So let's talk about poor risk assessment. People tend to believe people close to them. That can be either people they live with or people they love or people with whom they share an affinity online. That's why these anti-vax groups online do really well, because they can pull together a community from all over the place and reinforce these messages in an echo chamber. As I said earlier, there's also no real experience with disease risk. People have been lucky enough not to see these diseases, and they may think, well, I'm not going to get it. I've never seen it. Why put my kid through that? There's also magical thinking that maybe if I ignore it, it'll go away. I live in a house that is about 110 years old, and I've lived here for 30 years. And when I first moved in, every time I'd hear a noise, I would just think, maybe it's not a leak in the roof. Maybe it'll just go away. That's the way we are. That's the adrenaline response. It's not just fight or flight. It's also freeze. And when it comes to vaccines, that's what a lot of people do. They think, I just don't want to think about it. Also, as we talked about with those ministers, there's complicity with a potentially dangerous act, so that even though the risk of disease is real and disease is bad, if someone gets it or their child gets it, they'll think, well, that was bad, but it just sort of happened. But if I give my kid a vaccine and they get sick from that, then I caused it, and I don't want to be part of that. There's also a tendency to confuse association with causality, that because things happen around the same time in a child's development, that one thing caused the other. And there's one quick story I want to tell you. It's AIDS versus the pickup truck. So way, way, way back, 1986, 87, I was working in East St. Louis, Illinois, and I had become the chair of the St. Clair County Task Force on AIDS. At that point, I figured that everyone knew how you got AIDS, how HIV was transmitted. But there was a child in the Belleville, Illinois school district who had contracted AIDS through a blood product transfusion because he had hemophilia. He wanted to go to school with the other kids, but a lot of parents in town were very upset about it. So I went to a public meeting one night, a town hall meeting in the gymnasium at Belleville High School. They pulled out all of the bleachers, and I was seated at a table with a couple of other public health officials, and we explained the epidemiology of HIV infection. And then we said, any questions? And all these hands went up. Okay, how about if a mosquito bites that kid and then bites my kid? Can my kid get AIDS that way? Well, interesting question. There has been, that has been investigated, but they found that even with mosquito bites, everyone who got AIDS got it through one of the things we talked about, through blood products or through sexual contact. What if that kid drinks out of a water fountain, then my kid drinks out of a water fountain? Well, there are a lot of things you can get from a water fountain, but AIDS is not one of them. How about if that kid bites my kid? Well, there has been some question as to whether AIDS can be transmitted through human bites, but it's never been shown to happen, and this kid is not a biter. And then finally, someone asked the question that people always ask at a time like this. Can you absolutely, positively guarantee me that if my kid is in the same classroom with that kid, my kid won't get AIDS from that kid? And I'm thinking, have you even been listening? And I was kind of pissed off. And I said, look, it's very clear how HIV is transmitted. But if you're asking me, can I absolutely positively guarantee you that it won't happen? Well, no, I can't prove a negative, even though the evidence is overwhelming that it can't happen. But the chance of it happening is about as likely as the chance of a meteorite falling out of the sky right now onto this gymnasium and killing all of us. That is how vanishingly small the possibility is. Oh, by this point, things were over and everyone was going to their cars. And I went outside and I looked up the sky at Orion, my favorite constellation. And I was thinking, well, this too shall pass. Orion will be here. He's been here. He'll always be here. I saw that guy. He's walking with a woman who I assumed to be his wife and a couple of kids who I assumed to be their kids. He goes to the passenger side of a pickup truck. The woman goes to he goes to the driver's side. The woman goes to the passenger side. And the two kids, of course, get in the back of the pickup truck. And they drive off into the night with these two kids laughing and squealing and rolling around in the back, unrestrained, in a pickup truck. And I'm thinking, you idiot. You're concerned about your kids getting AIDS and you are taking this chance with them? People are just not good at risk assessment. But on the other hand, I've thought about that moment a lot over the years. I really didn't answer his question. He was asking me a question that seemed like a factual question, but it was really an emotional question. What he was saying is, I'm really scared for my kid's safety. I really need you to reassure me. And frankly, I gave him a kind of a snarky answer. I wonder if things might have been different if I had done otherwise. So we talk about poor risk assessment, association versus causality. These are a couple of things that that anti-vax websites put out that look at rises in autism levels, diagnoses versus when MMR is introduced into the population. It doesn't seem to account for the rise of autism diagnoses before that based on improved recognition and so forth, as well as the number of components in a vaccine versus the rise in autism also. Now, if you look at it, there's also been a rise in the rates of autism at a rate that's very much like the rise of organic food sales. So who knows? Maybe Whole Foods is responsible for all this. One thing that the anti-vax movement is good at is they have really created some martyrs around this, the primary one being Andrew Wakefield. It turns out that the British licensing board took away his license to practice medicine because of all of the falsehoods that were in that original paper, as well as because of everything he's done since then. However, this has only increased his credibility in the anti-vaccine community. As J.B. Handley, the founder or one of the co-founder of Generation Rescue, which is Jenny McCarthy's organization from the past, said, "To our community, Andrew Wakefield is Nelson Mandela and Jesus Christ rolled up into one. He's a symbol of how all of us feel." I mean, why not just throw in Mother Teresa while you're at it? So the anti-vaccine advocates, they're really good at compassionate messages. Wakefield has said things like, "What happens to me doesn't matter. What happens to these children does matter." Jenny McCarthy, who's been an anti-vax stalwart, as we know, has said things like, "In profound solidarity, I decided to speak up, and we're here to voice options too often unspoken and share hope for victories within reach at 3 p.m. and 3 a.m. It's very, very compassionate. Now, how do we put across our messages? Well, in his book, Deadly Choices, How the Anti-Vaccine Movement Threatens Us All, Dr. Paul Offit stated, there's a war going on out there. On one side are parents, on the other side are doctors, caught in the middle are children. Now, I have a great deal of respect and admiration for Paul Offit. He has been a stalwart champion of vaccination forever. I just don't think that statements like that are terribly helpful. I don't want parents to think of me as being their antagonist in a Solomonic struggle for their children. I want parents to know that I'm on their side. And while we may say things like that here, backstage, saying that sort of stuff on stage is not helpful. Even worse was a local pediatrician in St. Louis who was interviewed in the Ladue News in 2009. In 2009, 2010, that winter was the winter of the H1N1 flu pandemic. It was a really bad flu, and everyone thought it was going to be a terrible, terrible thing. And so the H1N1 vaccine was introduced late in the season, separate from the multivalent vaccine that had been introduced earlier. Now, people had questions about this, quite reasonable questions. Is this a new vaccine? Has it been tested? Well, as it turns out, it had been tested. It just hadn't been included in that year's vaccine because nobody knew that H1N1 was going to be a thing. So it was introduced later, but it had been thoroughly tested and thoroughly vetted. And I was interviewed in this same article, and I said, "Yeah, I get that people have questions about this. It is safe, it is effective, and if young kids get the flu, particularly this flu, they can end up being very sick. So I hope you get your kids vaccinated." However, another pediatrician in the community said, "I tell parents that there is absolutely no data to support a vaccine autism link," which is true. It's a fact-based statement, and it's true. But then he goes on to say, "And failure to vaccinate children is foolish and dangerous," which is now we're getting to the point of being insulting. Then he says, "Immunization is safe and effective, all right, with minor side effects." Well, okay. And then he goes on to say there's a small but real chance of complications, including fatal complications, with both the chickenpox vaccine, which, mind you, the article is not even referencing, which can lead to pneumonia, encephalitis, and hepatitis, and the influenza vaccine, which can develop into pneumonia or other secondary bacterial infections. Now, I ask you, ladies and gentlemen, if you were a layperson reading this in Ladue News, would you run out and get your kids and yourselves vaccinated against H1N1 flu? I don't know. But the question comes up, why do we say things like that? Why do doctors and nurses and public health people say things like that? Well, I think it gets down to this. Why do we do what we do? We are smart people. We have worked for years to get where we are and to do what we do. We believe in science. We are also caring, good people. We go into this to help people. We are here for you. And so when someone says, I don't want you to give my kid that vaccine because I think you're going to hurt my kid, we take it as really an attack on who we are at our core. So it's a struggle for us to remember it's not just about us. Because as much as we believe in science, we have emotions. We have an amygdala also that is responding emotionally at a time like this. And so we have to be able to let those thought balloons go and move on to the next place. So what can we do? In 2008, Larry Churchill and David Schenck wrote a really excellent article called Healing Skills for Medical Practice. What they did was they surveyed physicians and other healthcare providers in Nashville, where they were at Vanderbilt, to ask who were the best doctors in town. And what they came up with was a list of 50 people. And when they interviewed them, they found out that these people all had something in common. There were these 8 aspects of a master physician. Do the little things. Pay attention to detail. Take time and listen. Be open to what a person has to say to you. Find something to like or to love about this person across from you. Remove barriers to care, whether it's financial or linguistic or whatever. Let the patient explain what's going on before we jump in with our data and our information. Share authority for care and for diagnosis, and be committed and trustworthy. Let people know we're going to be in this with you no matter what. What's interesting is there's nothing in this list that has anything to do with medical knowledge or procedural skill. Those things are expected. Every doctor, every nurse, every public health person has a skill set that they have to be good at what they do. But to be true masters of it, to be outstanding at it, we have to go to this place. And so what we have to do is we have to create trust. We have to assume parents love their kids and recognize that parents are coming from a very, very, very different media ecosystem. So when people start bringing these things to us, rather than confronting them with facts, ask them about their fears. Honor and value their emotions. Their emotions around this, their fear about this, may not come from any facts. It may come from complete fabrications, but the fear is real, and we have to respect that and recognize it and honor it. Then that's the place where we can finally share our stories and share our information to help parents recognize the appropriate target for their fear, which is this disease, and provide a fertile ground in which trust can grow. Now, one thing that I think can be really helpful with this is an appreciation of improvisational theater. I'm also an actor and an improv person and a performer. And this gets down to what's called the yes and response. Now, if you've never, probably everyone has seen at least one episode of Whose Line Is It Anyway? And the yes and response means finding something to agree with the other person on and then add to it. So when it comes to something like someone saying, I've heard some things that scare me about vaccines, that vaccines might cause autism, the response, the yes and response is, yes, vaccines cause autism. Yes, we're not going to vaccinate your kids. The yes here is, yes, I see you love your kid, and I see that you're scared for your child's safety. And may I add something to that? This is actually a form of what Carl Rogers called unconditional positive regard. He was the pioneering psychotherapist who started client-centered or patient-centered therapy back in the 1950s. Close and positive regarding as active engagement with the other, finding somebody to like or to love about this person across from you. This is where we can finally start to have some communication. So our roles are very important. When I am acting as a doctor, when I am in my office, I have to remember that people expect a certain kind of demeanor, a certain compassion, a certain ability to listen. People do respect us. They respect us as healthcare providers, doctors, nurses. Whatever else has gone on, we are still at the top of the list in terms of respected professions, and we can use that. So using the yes and, we want to avoid the no but. We are good at the no but because we are smart and we have lots of good information, and we want people to have the right information. And amongst ourselves, when I'm with students or with residents or other learners, I'm like, oh, no, that's wrong. That's wrong. But here's what you should know. And here's the article you should read. That does not work with our patients. In fact, it shuts down communication. So saying things like, no, that's wrong. What you need to know is this, or even worse, I care about your kid. If you loved your kid, things like, I hear the fear in your voice. Fear for your child's safety is normal and natural and healthy. I know you love your kid. I want the best for him too. Here's what I'm afraid of. This is where you can start talking about it. So this is where we script the vaccine encounter. This doesn't mean you read it off a piece of paper, but keep in mind where you want to get from point A to point B. First of all, make vaccines an expectation, not an option. People have to opt out of it rather than opting into it. They come to us for expertise, for advice, for guidance. So starting with today, we'll be protecting little Harriet against some bad infections by giving her first set of vaccines. It'll be three jabs and a squirt in the mouth. Not, we recommend Harriet get her vaccines today. What would you like to do? Your accountant doesn't say, hey, it's tax time. You want to file your taxes? And you have to make sure that everyone in the office is on the same page. At that first checkup, you want to give a roadmap of encounters for the coming year. So at that first well baby visit, I'll be saying, we'll be giving Harriet her first vaccines at her 2-month visit. And these will be repeated at 4 and 6 months to make sure she's fully protected against these diseases. And after that, she won't need vaccines again until 12 months. What questions do you have for me? This is where you can make the narrative personal. Now, if you're fairly new at this, if you're a younger person, a new graduate or a trainee, you can say, something, I haven't seen these diseases, but that's because everyone I knew had vaccines. I also know from my teachers, like Dr. Haller, that the first time I see a disease, I'm going to remember that the rest of my life. I don't want to remember your child the rest of my life for the next 40 or 50 years as that first kid I saw with whooping cough, and I don't think you want that either. On the other hand, I can say I've seen life-threatening diseases nearly disappear. I was old enough to have had measles when I was a little kid. In 1963, 1 million kids had measles and 1,000 of them died of it. We can prevent that. I don't want your kid to go through that. I know you don't want that either. So yes, and there may even be places where you can agree a little bit more. Everyday metaphors. So, you can try, if someone says, you're right. I mean, it's unlikely your child is going to get the flu. It's also unlikely that you'll be in a car accident on the way home, but I know you're going to put her in a car seat because it might happen. And you don't want to take that chance. So now just a little bit on COVID vaccines. The primary drivers of COVID vaccine hesitancy seem to be, I think quite understandable concerns about the safety and side effect of this vaccine because it is so new. And that was exacerbated by the Johnson & Johnson pause. There's also still a good lack of knowledge, a fair amount of lack of knowledge about the vaccine. And there is, frankly, some distrust in the political and economic climates in which these were developed. When people talk about how fast these vaccines were developed, there are a couple of things that I think we can say. First of all, they were developed really fast. It is amazing that we have the technology to move these things along so quickly. Actually, the technology has been around for about 10 years, and this is the first vaccine that has been developed from it. And it's really, I'm really happy that they've been working with these things for over a decade, and now there's an application for it. The thing is that no corners were cut. And when you look at the various stages at which we test vaccines, the phase 1, phase 2, phase 3, those historically have been done one after another, and each would take months. But this time, for the first time, we've been able to do those things at the same time, almost on top of one another. It's kind of like when I was a kid in 4th grade. I remember that experiment in electricity. You might remember it, where you'd have 3 light bulbs connected by wires, and electricity would go through them. And that was called a series circuit. But if they were put next to each other and each one had a wire going in and each one had a wire going out, that was parallel. It's kind of like the COVID vaccines have been developed in parallel, and that's just as efficient and just as good. So what are some of the motivators for vaccine acceptance? By far, do it for your family is the most powerful motivator. Over half of people said they would do it for their family. Doing it for your country, 20%, the economy, 13%, your community, 8%, your friends, 6%. So I don't know if any of you remember a really terrible movie called 2012. It was about the end of the world. Well, this is a picture from it. Here's John Cusack running for a plane, and behind him, the world is being destroyed. And I think his ex-wife is reaching out for him, and he is trying to get on that plane. And here we have that plane flying over, I think it was Los Angeles, as buildings are falling down and millions of people are dying. The only people anyone cares about are the people in that airplane. The reason I bring this up is people have often said, why don't we use the argument that there's some kids in the community who can't get vaccinated and other people who can't get vaccinated because of medications they're taking or something. Do the vaccine for them. Honestly, that argument falls on deaf ears. Going back to that previous slide, for your community, 8%. For your friends, 6%. For your family, the people in that plane, that's all that anyone cares about when they're in a position where they're feeling a little threatened. So the other thing is that, when you think about it, COVID vaccines are kind of like a new app or a new thing. Now, I have my iPhone here. It's an iPhone 6. It's really old. I am a late adopter when it comes to technology. And a COVID vaccine is like any technology. As much as we want to get the newest thing, a lot of people want to wait a little bit. And as much as we've heard about people not wanting to get the COVID vaccine, every day, more and more people want to get it. So more people are coming on board. As long as we can share our stories that work for us and you can protect your family, that's what works. And the other thing that people want to hear is they want to hear from us. The most important influencers are doctors, are nurses, are healthcare providers, not politicians. It's us. So between us and other influencers in the community, these are the people, if we say, yeah, this vaccine is important and we are going to get it for you and make sure you know where to get it, that is liable to get more people vaccinated. So finally, I just want to add, just when you come right down to it, our challenge, meeting parents where they are while still serving kids, assume parents love their kids. Don't always say, well, if you loved your kid to do this. Don't ever make that conditional statement. Just assume parents love your kids. Say, I know you love your kids. I feel this is best for them. I hope you do it. Ask about the basis for their fears and discomfort. Honor and value their emotions. Acknowledge that parental fear and discomfort is real and even healthy. That's when we can finally share our stories and help parents recognize that they should not be afraid of vaccines, but of these diseases, and provide a fertile ground in which trust can grow. So thank you so much. I will be around for some questions and comments and conversations, but thank you very much for your attention.